Hey, good evening. It's Marion from the New York City Organization of Public Service Retirees. I was asked a question today because so many DC 37 locals are getting some pushback from either people in, there's some people in the district council, Henry, people from legal. And what they're asking is, how come we're saying that this economic agreement that they're trying to get them to ratify, how is it that it affects their health care? And I said, well, that's really simple. In the summary that they gave you of the economic agreement, it said in number 5 that you continue your premium-free health care based on the MLC agreement, but they don't tell you which one. And it also tells you that if they're going to ask you to ratify the agreement, why are they giving you a summary and not the full contract? Because the devil's in the details. What's in the contract? What is the MLC agreement? What are the side letters? Do you know what you're signing? You're just looking at the $3,000 sign-on bonus on the retro pay and you're going, ka-chinga, I'm in for this. But what about if it gives up something? Do you know what it gives up? What if you found out after you signed it that you gave up your healthcare benefits or reduced your healthcare benefits or sold out your current retirees and your future self? Do you know what then you would do? Kick yourself in the pants. So why don't we make sure that everything that you should know before you sign an agreement, you read first. That's really what you're asking. Let me read the contract before I sign it. So someone said to me, well, how do you know what's in there? And I said, well, that's really easy. I'm going to show you. So I'm going to pull up, this was from the Department of Labor's website. And this is the 2000 District Council 37 Memorandum of Economic Agreement. Just going to scroll down so you can see it's exactly what it is. This was for 27 months from the date of termination of the applicable existing agreement. And I want to go to, let's go to page 11. Now, what do you see right there? Number 17, continuation of certain health benefits. And it tells you that the parties agree that the following provisions of the 1993 Municipal Coalition Agreement, it actually numbers it and tells you, because all MLC agreements have a year, shall remain in full force and effect as otherwise modified by the provisions of the 2000 DC 37 MEA and appendices. It talks about the health spending account. It tells you what the city will pay for. And bottom of page 12, this is what I keep telling you. This says section 20, pension benefits agreement, redeployment health agreement, and health benefits agreement and letter agreements. Remember, I told you, you need to always look at what letter agreements, what side letters, what appendixes that they refer to. Pension benefit agreement hereto attached as Appendix A, the redeployment agreement hereto attached as Appendix B, the health benefit agreement attached hereto as Appendix C, and the executed letter agreements hereto attached collectively as Appendix B are deemed to be part of this 2000 DC 37 MEA. And that is super important, okay? Because it tells you everything that's in this agreement. Now, if I could find the right page. B. This was the redeployment agreements for 372. We're getting closer. There we go. Appendix C. The health benefit agreement between the City of New York and the MLC. The memorandum of agreement as to health benefits hereinafter agreement entered into this 11th day of January 2001 by and between the City of New York, including all employers whose employees and retirees are covered by the New York City Employees Health Benefit Program, collectively the city and the Municipal Labor Committee for health benefits bargaining hereinafter the unions. Whereas the parties have fully negotiated and achieved agreement as to certain benefits and or modification to benefits which shall apply to employers, employees, and retirees covered by the New York City Employees Health Benefit. Do you see what I'm saying, guys? If you don't read your own documents, you will never know what's in them. This is your health care. This is attached to your contract. Don't let them lie to you. Make them show you what the agreement looks like. Do not just accept on face value that it's not here. I'm showing you right here, it's in the contract. This is your health benefits. This is even funding for your welfare funds. Funding was for the stabilization fund. The amounts to be contributed to paragraphs 4, pursuant to paragraphs 4, 5, and 6 herein shall be subject to a side letter amending the current effective existing welfare fund agreements. Side letters, remember I told you, side letters are not included in a contract because they can be modified or negotiated up or down outside of the contract. Within the contract, it's more difficult to do that. So they make a side letter. This is why I said side letters, appendixes, any agreement that they say is attached because it gets rolled in right here. So now you want to know what, look, number 3, retiree health insurance coverage. The parties shall jointly take whatever action is necessary, including to support joint legislation to modify retiree eligibility for health insurance coverage so that vested retirement retirees with less than 10 years of credited service as a member of such retirement or pension system shall no longer be eligible for health insurance and welfare fund benefit coverage, although they may be vested for pension purposes. You see, they're diminishing your health care. And this is for 2000, mind you, this is not current, but they are diminishing your benefit even before. This is why we keep saying you've got to pay attention. So yeah, and then 4 was your welfare fund contributions. 5 is your contributions increase. Your drug subsidy, that's 4, 5, and 6 that it mentions. I mean, this is all stuff you guys, you guys absolutely, need to know. Stabilization fund contributions, which is what they're saying to you that you don't have. There's no money in the stabilization fund. We have to absolutely sell off those retirees so that your premium-free health insurance stays premium-free. Please read, guys. It's really that simple. Everything you need to know is in the contract, and I'm going to tell you why. We are reading the contract agreements for the Aetna Medicare Advantage plan that they all voted to put us in without ever viewing. The devil's in the details. We've said it before. We read the last document, the last time they tried to force us into Medicare Advantage, and once again, here we are. Read. You would never buy a car, and you would never buy a house, and you would never buy anything expensive if you didn't read the contract, because then you don't know what's expected of you. And see, and this is why we keep telling you, you should read your contract. You should read your governing bylaws. And if you don't have governing bylaws, ask your union presidents for those governing bylaws. And if you don't have them from them, call Henry. Because you should absolutely know the rules that they are subject to, so you know if they're following them, which is why you get your. All right, that's another one in the can. Understand, your union is only as good as you make them be. You need a good, strong union. Keep them honest. Everything should happen in daylight. Make sure that what they're giving you is exactly what you're owed, and that they're not negotiating away something that you do earn. Otherwise, they're sticking their hand in your pocket when you're not looking. Don't do it. Have a good night.